It is our appointed starting time for tonight's forum about Medicaid. My name's Jeff Munzinger, and if we haven't met, I'm a candidate for the legislature. We have some other candidates here tonight for the Missouri House of Representatives from District 136, which is on the other side of Campbell Street. So that's me. And having run for election before, I know I talked practically at every door that we knocked on about the idea of expanding Medicaid in Missouri. And of course, we haven't done that, and we've hardly even discussed it in our legislature. So tonight, we have a wonderful panel here. We're so glad they could join us tonight. I'll introduce them real quickly, and then they will tell you about themselves. Dr. Stephen Adams from the AIDS Project of the Ozarks. We have Rebecca Johnson with Missouri Healthcare for All. We have Lynne Meyerkord from AIDS Project of the Ozarks. And we have Kristen Moore with Planned Parenthood. So with that, why don't I let you all just say a few words about yourself, and then Rebecca will make comments first. So after you introduce yourselves.
Oh, we're starting at this end? Mm-hmm. I said at this end for a reason. The microphone's there. Does that work? It will. It takes just a second for the green light once you turn it on. Oh, you got a green light. Okay, now we have a green light.
I'm Kristen Moore. I volunteer coordinator for Planned Parenthood. I work in here and in Joplin. I'm the coordinator for Southwest Missouri. Previously, before this job, when we had the grant, I was a navigator for the Affordable Care Act, which meant that I did a lot of outreach and assisted people getting health insurance through the Affordable Care Act or the Healthcare Exchange. So that's my experience in this realm.
I'm Lynne Meyerkord with APO, and we provide medical care for folks with HIV and AIDS, but also for folks that are looking for primary care or hormone replacement therapy for transgender folks, and also pre-exposure prophylaxis, which is a pill that, I'm very much simplifying this, that if taken daily can help prevent the spread of HIV. And we have about 1,200 patients in our clinic. So obviously the ACA has been very important, and the expansion of Medicaid would seem to be the smart thing to do, but what do I know?
Hi there. My name is Rebecca Johnson. I don't know. Oh, okay. I did something wrong. My name is Rebecca Johnson. I'm the Springfield organizer for Missouri Healthcare for All, and we have advocated for Medicaid expansion for a long time. And really, our vision is right in line with expanding Medicaid. We want to make sure everyone in the state has access to care no matter where they live or how much money they make. And that guides everything that we do.
And I'm Stephen Adams. I'm the medical director for APO. I take care of all of those 1,200 patients that we have in our clinic. We have a significant number of folks who are uninsured because their income falls below the level of what they need to have in order to qualify for an ACA plan. But they make, and they're not eligible for expanded Medicaid, so they're stuck between a rock and a hard place. They just cannot get we're fortunate enough that we work with a board and an executive director who allowed us to continue to provide care to those patients despite their lack of insurance.
Take this one. Hello. Hello. All right.
Try this one.
That one? Okay. All right. All right, I'm going to be over here so I can see and click as I talk. Like I said, my name is Rebecca, and I work for Missouri Healthcare for All. And we do a lot of advocacy work in the Capitol, and Medicaid expansion has been something our legislators, for the most part, have not been open to. So first, I kind of want to explain what Medicaid is. The purpose of Medicaid is to help provide health insurance to low-income folks. It is a federal and state-run program, so that means the states can make some decisions of who they want to qualify and all of that jazz. In our state, it's quite hard to qualify for Medicaid. First off, you have to meet some income requirements, which we'll get into more later. But you also have to be in one of these 4 groups. You either have to be a pregnant woman or a parent with like dependent children, or a child, or a senior citizen, or a person with a disability. So first, I kind of want to touch on what is really the cost of us not expanding Medicaid. I wasn't really in this field of work when the ACA came about, but we had the chance to expand Medicaid and they would have covered 100% of those costs. Since then, we have had 6 rural hospital closures. There's actually one in danger of closing in El Dorado Springs. And this is happening because a lot of these folks are uninsured because they fall in the Medicaid gap. When they're uninsured, people who are sick and need health care, they don't just not go to the hospital and get care. They go to the emergency room because that's the one place you cannot be turned away. So they'll get their health care that they need, often having to put it off until their condition is so bad that they have to do something. So when they're not able to pay for that bill, that falls back to hospitals. Hospitals have to figure out how to make up that cost. And sometimes they close, and sometimes it also raises costs for other people because they have to make that money up somewhere. So it actually can affect everyone, even if you aren't in the Medicaid gap. So another thing is that families really face a lot of hardship with this. This is a super helpful graph, and actually these are not even updated because there have been some federal changes to the federal poverty level, which actually lowers it. It lowers it further, so you have to make even less to qualify. And these numbers over here, these are what you will make a year. So for a custodial parent to qualify, they have to make no more than $4,000 a year. Now it's $4,440 for a family of 3. You can't live off of that in Springfield. In a family of 2, you can't make more than $2,900 a year. That's like a single parent. So these are not really reasonable things, and that's why we want Medicaid to be expanded, because that allows the eligibility level to go up on the federal poverty level line. And childless adults are not even eligible at all, no matter what their income. So this is Jamie. At Missouri Healthcare for All, we have a story bank project where we collect people's healthcare stories, and we have a lot of Medicaid gap stories. And this is Jamie from Potosi, and I'm actually gonna click on her picture, if I can, yeah, because she actually has a video that she made with us a while back. And I can tell stories, but I think it's better if you hear them from the people themselves.
My name is Jamie. I am a 29-year-old proud mother of 5 beautiful children, and I live in Potosi, Missouri. I am a home health care attendant. I work at a local auction and just recently got another job at the Super 8 Motel. I suffered injuries in an abusive relationship that resulted in me needing surgery on my back. I need to go see a neurologist because I have really bad migraines, and whenever I have them, sometimes my nose will bleed. I can't afford to see a neurologist. I work every day and I make too much for Medicaid. My job does not provide insurance. And right in the middle of that gap where I don't have insurance, I don't make a lot of money. I make less than $1,100 a month. 3 or 4 years from now, I really don't know what I'll be doing. I don't know if I'll be in a wheelchair. I can't wait 3 or 4 years. The doctors that I go see, told me I needed to sign up for disability. I'm 29 years old. I don't want to sign up for disability. I want to be able to go to every one of my kids' games and be in the crowd like everyone else. I want fixed. I want help. I want to be normal.
So, especially with her situation, she could go on to disability and would probably get it. But when you are 30, you should not be going on disability when there is another solution that could keep you active and able to stay with your kids and keep up with your kids as they grow up. It's ridiculous, frankly. And of course, single childless adults cannot qualify no matter what their income is. For them to qualify for ACA subsidies, they must make about $12,000 a year. And that's actually the biggest group that would benefit from Medicaid expansion, are all these single childless adults who can't qualify no matter what. And so here's kind of, if you guys are curious, where these people are, where these uninsured adults who would be eligible if we expanded. This is from 2017, but I'd expect it to be quite a bit bigger now, especially with the Medicaid purges. I don't know if you've heard about that, but we've had over 120,000 people just be dropped, even though they were still eligible. So, side note. So, with Medicaid expansion, single adults can make $16,000 a year and qualify. Families of 3 can make almost $30,000 a year and qualify, and families of 2 can make $23,000 a year and qualify. And if it weren't for the ACA and I weren't on my parents' insurance at the time, I would have fallen in the gap if I didn't have that at that time. And so, of course, the big picture is that this would bring more health care to more people. We would be expanding to about 219,000 people. We have about 500,000 uninsured people. We would cut that almost in half if we expanded in our state. We would have 50,000 parents who would be able to qualify, and 20,000 seniors. Oftentimes it's really difficult for people who are not yet 65 to find reasonable health insurance. They have some of the highest health costs. And Missouri overall would benefit. We would have way more rural hospitals staying open. We would be bringing back $1.5 billion a year. And this isn't money that's just coming out of nowhere. This is our taxpayer money that is going to the federal government that we can't cash into because we haven't expanded. So we would be getting that influx to help take care of more of these people. And of course, more health care to more Missourians. So yeah, that's all I have to say so far.
Lynn, do you have some comments you'd like to add?
I'm going to stay here because I don't have a PowerPoint thing. When Debbie first asked me to speak about this, I was thinking, I mean, I know about Medicaid because we deal with it every day, and we deal with folks who have it, and we deal with folks who don't have it and need it. And so I'm just going to kind of chat for a little while. You know, Dr. Adams and Rebecca both mentioned the healthcare gap, which seems on the face of it, in terms of common sense, really unfortunate that the folks that are the poorest have no access to Medicaid. That really doesn't make sense. And for them, they have no access to health care unless they do go to the ER, which jacks up everybody's costs that have insurance. And I think the rural hospitals closing, that's something that a lot of us in healthcare saw coming when the Supreme Court got rid of the Medicaid expansion mandate and left it up to the states. So we're not unlike the other states, especially in rural areas, that are losing that health service. And those hospitals are kind of central locations for people who already have challenges with transportation and also have challenges with income. Where are they going to get their health care now? So there's many layers to this. And certainly the groups that are working full-time on this are to be commended, because it's got to be a little like beating your head against the wall, quite honestly. So I think if people can get educated, there are a lot of parallels to HIV and AIDS. If you get educated and you figure out how to address the problem, it goes a long way.
If anybody would like to ask a question, just raise your hand. We'll bring you a card and a pen, and you can write it down. If there's not a lot, we'll just actually go to the microphone. But I'll hand out, Dave and I will hand out some cards and some pens if you have a question.
So if I was going to touch on one particular aspect of this, I think the most important part that we all need to understand is that by not expanding Medicaid, people in Missouri are dying at a higher rate than if we had Medicaid. And that increased risk of dying is 6%. So for folks in states that don't have expanded Medicaid, 6% more people die every year because they don't have access to health care. That's a lot of people. And you know, the cost of care is just outrageous in this country because the insurance companies get, you know, if you're paying cash, you pay full price. If you have insurance, you're going to pay 40%, 50%, not more than that, of what the actual cost, the bill is. Poor people can't afford to pay full price. You know, rich people can't afford to pay full price. We need to find ways in this country, and particularly in Missouri, that we can get care to those who are most at risk of dying, so that we can have overall just a healthier community. And I think that's probably it from a healthcare provider. To me, that's the most important part.
So as I said originally, my first job with Planned Parenthood was as a navigator for the Affordable Care Act, and part of that was doing a lot of outreach to explain what the Affordable Care Act was, to explain to people how they could get insurance, to try and get people to sign up for insurance. And having that job in Missouri was so frustrating because the majority of people I talked to were in that Medicaid gap when we were doing that outreach. And we kept track of numbers, and I will say I looked them up today because we haven't had that grant for a while, and it was well over 1,000 people the last year we had it, from the navigators we had in St. Louis and Springfield and Joplin, people that we just talked to at a table, like we would have a table out here at the library once a week, who fell into that Medicaid gap and couldn't access insurance. Or people who called us and said, I'm sick and I need insurance, and I couldn't help them. And I will say the numbers are different in states that expanded Medicaid. If you expanded Medicaid, people who are up to 138% of the federal poverty line qualify for the subsidies, who are beyond that. So 130, if you make 138% of the federal poverty line, you qualify for subsidies. In states that didn't expand Medicaid, they changed that and said, okay, you get the subsidies at 100% of the federal poverty line. So there's that 38, even that group of people who are destitute and poor, and they got extra help on their co-pays and things, but they're still having to pay into something. But in other states, they wouldn't be. So we're still, even that we didn't expand it, and there's those people in the gap, there's that other gap that we don't really recognize from 100% to 138%. And that's why the story that Rebecca showed of that woman with those 5 kids didn't qualify for the subsidies, because the subsidies are tied to your income and your family size, who you claim on your taxes. So the more dependents you have, the higher your income has to go to qualify for those subsidies. And so I work at Planned Parenthood, and I'm just going to say this. We're saying the more kids you have, the less access to health care. The more dependents you have, the less access to health care we're going to let you have. But we're also going to take away your rights to not control that. So that's, an extra layer on this whole happy Sunday of events. So I just think that I think people don't realize, and I have been on Medicaid. I was on Medicaid. And I got kicked off Medicaid very shortly after having my daughter be a C-section, my second child, and, I had to have a C-section because my ex-husband lost his job, we lost our insurance, and it does not, and I think now even you don't even make it to your first appointment before they kick you off Medicaid after you've had a child. Yeah. And so and with the maternal mortality rates in Missouri being what they are, I just think that there's a lot of work we can do. This is super important work, and it needs to happen here.
We have a couple of questions for the panel, but I wanted to mention real quickly, I just checked as of August 1st, does anybody know how many states have not accepted the offer to expand Medicaid? It's 14. We're one of 14. 37 states have proceeded down the right path. Okay, so here's the question. We have a couple. They're very similar, and I bet this is in everybody's mind. What was and continues to be the reason why Medicaid was not expanded in Missouri? Why don't we have it? What do we need to do to get it? Who declined Medicaid expansion?
I'd like to see the answer to that first question first, and then go into the second one.
Read the first one.
Okay, what was and continues to be the reason why Medicaid was not expanded in Missouri?
I'm happy to take that. Because our legislators did not vote for it. They didn't pass it. That's exactly why we don't have Medicaid.
Why is it? Do they just don't like certain people or something?
Well, there was a Supreme Court ruling that said against the ACA that there's a Supreme Court ruling that said states didn't have to accept the Medicaid expansion. And I think the big argument that the legislators in the states that didn't accept it, even though at that point it was the federal government for this X amount of years would pay like 100%, X amount of years pay 90%, was that it would end up costing the state more than the state could afford. I mean, we're still not there. Still at this point, if we accepted it, the federal government would pay 90%. But that was their argument.
I have I've known this friend of mine since 1971, maybe, 50 years or so. He's a PhD social worker. I'm a master in social work, and I like the social science. And so he was saying that he resents it when somebody is freeloading for some reason. And I don't think that way. And so me and him got into it a little bit. I says, well, you know what? If we went to Medicare for all, it would cut the overall cost of health care by half. And I said, okay, just keep the freeloaders over here. Would you go for that, Bob? And he says, yeah, I'd go for that. That Medicare for all, when you cut the cost in half, he can handle a few people who aren't working.
This isn't Medicare for all.
I know, but that was his attitude.
Well, and if you look back at the ACA, and I feel like we're preaching to the choir, which isn't a bad thing. I mean, choirs are good. But if you look at the ACA and all the protests around that, you had folks in Springfield lined up with signs that said, no government health care. And you would go up and talk with them, and they were on Medicare. And guess what? That's government health care. So the issue of doing the right thing, I don't know how to convince people to do that. I think the answer lies in electing people that will vote in ways that make sense on certain issues. I mean, that's what you have to do.
I would also say, like, for instance, in Springfield, who are those freeloaders? Our unemployment rate is like what, 4%?
Less than that.
Less than that now.
And our poverty rate is 25%. Who are these people who are freeloaders and not working?
It seems like
it's not
an
the issue that they're not offered health insurance at their low-wage jobs.
Well, it's people that aren't doing math. They are going by a particular dogma or philosophy that doesn't look at science and doesn't look at math. I mean, if you look at the numbers by independent Office of Management and Budget, it's not going to cost more.
Here's another one. It was started by Obama. It must be bad.
Exactly.
And when that all started about, choosing whether to
we had a Democratic governor, Nixon, and a Republican legislator. They were going to fight him. It was so political. It was just unbelievable. He said, basically, if you don't take Medicaid expansion, things are going to happen. Places are going to, I worked for the Missouri Rehab Center in Mount Vernon. That was part of the University of Missouri, but we got subsidies from the state for the head injury program. No Medicaid expansion, no subsidies from the state. They shut the hospital down.
Right.
It was so political.
Yes.
Yeah, I kind of want to.
It takes a
I kind of wanted to touch on that because it is so partisan and political. But in my work, part of the story collecting, I've gone to some free clinics in the state to talk to folks and hear their stories. And it was interesting, like just sitting with them and waiting until the clinic opened and talking about, oh yeah, you know, people, they'll like have a support for someone that I, you know, wouldn't expect, because then they'll also say, you know, I think everyone should just have the same health care. You know, I wish we did have expanded Medicaid. And so even if healthcare is treated as a partisan issue, when it comes to everyone needing healthcare, that is the thing that, and we're a nonpartisan organization, like we're fighting for the healthcare for people of all parties. We're not discriminating, and Medicaid expansion wouldn't discriminate at all.
I'm wondering if any of you could share some examples or some stories of conversations you've had with legislators. I know I've heard when Lincoln Huff, who's now on the Greene, I'm sorry, he's a state senator now. He was in the Greene County Commission, but when he was in the House of Representatives, he was speaking at a public event. This is a few years ago when this first started, and he was asked why we haven't accepted the federal government's offer, and his answer was, well, you know, if we did, the federal government could come along and change the rules, and then where would we be? And, you know, I don't think they've changed the rules on anybody yet. So I just wonder if any of you have had opportunities in Jefferson City or even locally to talk to some of them.
Not specifically about Medicaid expansion. I can talk all about needle exchange and changing the criminal penalties for HIV transmission. And I think some of the philosophies follow along those same lines. And we don't have either one of those either.
Well, and I can say that the rules of the ACA have changed with the new administration, and they've made it more difficult to qualify, to prove your income, and do those things. And I can also say in Utah, where they did vote to expand Medicaid, then the state legislature in there stepped in and tried to not expand Medicaid. But their goal, right, was to expand Medicaid. The people of Utah voted to expand Medicaid. And their idea was that 150,000 people in Utah would get Medicaid if they did. So then the legislature stepped in, and how I talked about that 100% of the federal poverty line, that 138%. And so they only expanded it to the 100%. But that was still 90,000 more people who had access to health care that did not before. So I think we get frustrated about the legislature, but we need to remember that, like, even if we get it on the ballot and they vote it and they mess with it, that was still 90,000 people that had health care that didn't before this happened.
This is a good time to mention that there are petitions circulating, and Lynne is going to go out to her car and get some, I believe. Oh, we're going to get some. Okay. But we will have the opportunity to get this on the ballot through initiative petition. And as you may remember, we passed several things recently through initiative petition. So let's hope that we can make progress. Yeah, and we have a question right here, I think. Did you have a question?
Recently on the news, there's been mention of 135,000 people. And I see nodding heads. Could y'all comment on that? Oh, and the Republican Party issued a statement that because of the good economy, those people no longer qualify.
I can speak to that. Yeah, so we're at nearly 130,000 people who've been kicked off, and 100,000 of those are children. The idea that it's because of the economy does not make sense mathematically, because he's saying, oh, we've had unemployment go down by 0.3%. But we have the biggest decline that is 7.5 times what should be the national average in the decline of kids on Medicaid. It's not normal. And like we're hearing about people going into the doctor with their kids, hoping to get like their vaccinations and everything all caught up, ready for school, and they're told, you cannot be seen. We cannot see you. You're no longer on Medicaid according to our records. And oftentimes people have been calling back to try and get back on Medicaid, and then they're backed up on the phone for hours and hours and hours. And some people who have gotten through found out that their re-enrollment forms and stuff have been sent to the completely wrong address, even addresses that don't exist or that they haven't lived at for years. So the problem is that there was this new system implemented that re-enrolls people at a lesser rate. And we had a rally yesterday trying to call on Governor Parson to address this and decide to lead and say 100,000 kids kicked off of healthcare is not the state we want to be. That's what we want to urge him to rectify.
And the kids aren't leaving Medicaid and going to another healthcare insurer. They just don't have insurance anymore.
Right. If that were true, then the
then the chip kids on chip would be going up.
Right.
Because there's a lot of families who don't have health care through their insurance and they qualify for a chip, it's like the children's health care, and their parents still pay somewhat of a premium. It's not like they're being leveled up into the chip program and off of like the straight Medicaid. That's not what's happening.
Well, for me, it doesn't make sense because when everybody's now being forced to go to the emergency room to get any kind of health care, it raises the premiums on every other individual who have health insurance by $1,000 a year. And that was way back 10 years ago. Just saying.
We have a couple more questions here on cards. Can you talk about the economic effects of states that have expanded Medicaid versus those that have not? Everybody looks at Rebecca.
The actual numbers, I'm sure they're better off than we are.
Well, what we know from Arkansas is that as their number of uninsured patients went down, their rural hospitals became way more profitable. And actually OCH moved to Arkansas because they could actually bill Medicaid in Arkansas if they saw patients in those clinics. And so that's why the hospital here is closed and they have a hospital in Arkansas. And they are making money hand over fist at that hospital because seeing Medicaid patients in Arkansas because they expanded Medicaid there. And it makes more jobs for people, and it kids go to school more, kids do better in school, kids are more likely to graduate from high school, kids are likely to have more money as adults if they have health care as children.
Right, and with the economic impact, expanding Medicaid in our state, like studies into Medicaid expansion specifically for us show that we generate like about $2 billion in economic activity in our healthcare system, which would mean more jobs. It would mean more like healthcare centers having the funds that they need to serve more people.
Not to mention the folks who are actually getting that care are well enough to go to work.
Mm-hmm. Right, and then another interesting thing is that you know, you have the income limit. So oftentimes people I've talked to, they have to work only a certain number of hours because if they go over the limit, they'll lose their health care. And for them, a promotion would be worse because then they would no longer have the health care that they depend on. So that's kind of another example of how, like, sometimes people like to twist the narrative into it being freeloaders or whatever, but really these people are just trying to work within the system as it was set up or how it was refused to be set up in an intelligent way.
You only use the microphone when you speak because
Yeah.
we're recording this. So.
Okay. Okay.
A question. Sorry, turn this up.
A question. Is vocational rehabilitation a part of the delivery system to help adults and childless adults? Does anybody know the answer to that one?
Say it again.
Is vocational rehabilitation a part of the delivery system to help adults and childless adults?
I'm not sure what the requirements are for voc rehab. I know it's offered for folks like, okay, I'm old, that worked for Zenith. That's the first thing that pops in my head. They were eligible for job retraining when the plant closed. I know when I worked in mental health that there were programs to help folks that needed voc rehab and more training skills. I don't know about, I mean, I know Medicaid and voc rehab aren't necessarily tied together. I mean, they're very separate systems with very separate governance. But I don't have the details on what sorts of programs they have.
People with disabilities are also qualified for voc rehab, but it's not necessarily Medicaid. It's if they had a brain injury and they need, different kinds of work.
That's been cut back on. The funding for that's been drastically cut back also because of the disability administration.
Let's see if anyone knows the answer to this. Is the 90% reimbursement only on the actual health costs, or does it include increased administrative costs? Is the 90% reimbursement only on the actual health care costs, or does it include increased administrative costs?
Well, I would have to say to that I mean, my best guess would be that it would be mostly focused on the healthcare, but also it's kind of a balance with this because there are some sectors of folks who are on Medicaid that we are paying the full cost for. And so, like, for instance, some populations who are blind in our state, we cover the full cost of their healthcare. I would have to say it would be mainly focused on the healthcare, though I think that there definitely would be an increase of budget attention to making sure that there is the infrastructure to help run the system better, though we do need that right now as there's 100,000 kids off of Medicaid. So it's something that we need now.
I'll also say as an entity that bills health insurance, including Medicaid, they don't separate out you get this so much to pay your doctor and so much to pay your billing specialist. It's a flat rate, somewhere between $38 and $66 for a doctor's appointment or medical provider's appointment, depending on the level of the visit, the intensity of the visit. But they do not parse out, you get $10 for the admin fee and $45 for the doctor and the nurse and the supplies. They don't do it that way. So I can't imagine that the reimbursement would be based that way.
I have a question for Dr. Adams. Before you joined APO, you were in charge of urgent care at one of the local hospitals, but did that include the emergency room or no? No. Okay. Did you see people coming in who were in trouble, who didn't have any health insurance at urgent care?
I never knew what their insurance status was. As a physician, we're not allowed to actually know what the insurance status of a patient is. That's something that's handled by other folks, and so we just go into a room. But I heard lots of stories about patients who came in, and we'd say, okay, I think you need to have this test done, and they're like, oh, I can't do that. I don't have any insurance. I only can afford this visit. I can't afford to have an x-ray, and I can't afford to go see a specialist because I don't have any money and I don't have any insurance. That was a story that we heard probably every week, at least once a week, for each individual provider there.
I have a question for Kristen. Can you talk a little more about the impact for funding with regard to Planned Parenthood and Medicaid?
Well, so at this, I'm sorry, it's on. So at this point, Medicare, Planned Parenthood has been defunded, which means that we do not get reimbursed for Medicaid patients that we see. Planned Parenthood has continued to see those patients. We have also, there was a lawsuit, and we won that lawsuit, and they said the state had to pay us back for those patients, but they're appealing. And so that was for 2017, when they originally signed the budget to defund Planned Parenthood. We'll have to do it again for 2018. So at this point now, Planned Parenthood is not getting reimbursed for seeing Medicaid patients, but we are still seeing Medicaid patients. And I'll put a quick plug in that we have a grant called the Right Time Grant that will also give free birth control of the person's choice for people who are uninsured or underinsured. And so always, if you know anyone who needs to get birth control of their choice, to have them call our health center and make an appointment.
Are you still able to see male patients as well? I know that that's something that happened in the last few years, if I'm not mistaken.
Yes, we still see male patients. Yes. I'm not sure about the Right Time Grant applying to people who aren't seeking, contraceptives in that way, but the sliding scale is still there. And if they have Medicaid, which they probably wouldn't in Missouri. No. So that's a moot point. Never mind.
I have a question about the birth control that you guys provide for free. Does that include long-term contraceptives?
Yes.
Implant devices?
Yes.
Excellent.
Another question. Do you know what happens when someone overestimates their income so that they can qualify for ACA subsidies?
I do. So there are some safe haven laws. So it's dependent on how much you overestimated your income, and what percentage that is, and what your income is. So there's some caps on how much you would have to pay back in those subsidies. But it's all very dependent on your your family size, your income, how much you received. So, but there are, if you Google that, there are charts, and you can find your specific income range in there, and what the tax penalty would be. But it's not like, say, if you thought you were gonna make $12,000 and you got the subsidy and you made 13, you're not gonna have to pay back every penny that you got over that 12 months in subsidies. There's a cap on that.
Now flip it. If you know your income is going to be under the ACA subsidy, where if Missouri had expanded Medicaid, what if you overestimated your income, so now you qualify for subsidies?
Right. Oh, that's what I meant. So if you flip, yeah, that's what I was saying. So if you overestimate, so you qualify for subsidies, there's a safe haven rule about how much you overestimated and what your max income is, about how much you have to pay back, which I'm not remembering off the top of my head. But also, I think that used to be an easier thing to do, but now they do make you provide much more verification of income than they had in the past. So, if people I would have someone who was like, oh, I was out of work. I'm out of work right now, but I made this much, and I'm going to get a job, and we could maybe get them in there. But now that's not a thing. You have to have verification for everything with how the marketplace works.
Sometimes you hear people say, oh, we can't afford this in Missouri, but among the states that have expanded are, as Dr. Adams mentioned, Arkansas, also West Virginia, which has a lot of poverty, and Kentucky, and Louisiana. So it's not a valid argument when they say we can't afford it. Okay, here we have a long question. I'm going to read it. Mark Stringer, the current director of the Missouri Department of Mental Health, told a Springfield audience about 4 years ago that the most effective action that could improve mental illness in the state was to expand Medicaid. Young adults with behavioral health issues have a better life prognosis, let me read that again. Young adults with behavioral health issues have a better life prognosis when they have an early diagnosis. I would think there are statistics that show the same good prognoses for all diseases. Has this or can this be shown to the state legislature, pardon me?
I mean, technically it could be shown, but a response is not guaranteed.
Well, and I think it has been shown.
Yes, it has.
Sorry. It has been shown. I mean, that's not the issue. Facts are not the issue in our world anymore. Sorry, I probably shouldn't have a microphone in my hand. Yeah, that is not the issue because the facts are there. The folks like the Budget Project and so many other folks have done that research. St. Louis University Center for Law has done the research, and it doesn't make sense not to expand Medicaid. Let's just take the moral issue out. It doesn't make sense from an economic standpoint. As Dr. Adams said, if the kids have access to health care as kids, they grow into healthier, more productive adults. So logic is not the issue here. It's just not.
Mr. Trippy, here, let me bring you the microphone. Although you probably don't need it.
I don't need the microphone, but... So is propaganda the issue here then? How are you going to get the message out? Because as you said, I mean, this is a nice group of people. I love you all. But how do you get the message to enough voters to put pressure on their legislators? What kind of message and in what form can you reach them best?
I mean, I would have to say that reaching the legislators, we have been trying that for a long time, and I don't think that's a tactic worth our time. I think the time has come for us to think about putting it on the ballot and putting it to the people. As far as messaging, I would say two things. I would say sharing stories, because people, when they hear and they see someone's face of someone who is dealing with this in this horrible healthcare system that we have to improve for them, that changes people. And then also just making sure people have the facts and have the information. And I encourage you guys to look up all the other things that have happened in other states with Medicaid expansion. It's not just healthcare things that have continued. People are able to have better financial lives and able to have savings, and there are so many good things about it. So I would say that the main issue that people have is ideological, because they think of this person as getting a handout, but actually it's just getting our tax money back. So
I'm
that framing
old,
is good.
but is there a way for some of the people who are younger than me to put together a social media campaign that floods all the various social media with the stories? Because I do think the stories make a difference. Is there a way that you can flood it? Because I know that's cheap at first, but the more that you do it in a concentrated way in which you're hitting certain groups, becomes more expensive as you do it. But is there money available to put that kind of messaging out through social media, because you have a more receptive audience with the younger folks?
Sure, and I mean, I think that's something that'll remain to be seen if we would collect enough signatures to put on the ballot. But also, I think another great thing is that for people who know about this and would vote for it, there are a lot of us, and we can also be sharing these stories. And I would encourage you guys to look at Missouri Healthcare for All's website. We have a bunch of stories, and you can find all the people in the Medicaid gap, and you can find people in our own area who have shared their story. I think that's the most powerful place to start.
And I would say that before anything goes on the ballot or any initiative, we have these same conversations. And the midterm elections taught us a lot. We won the minimum wage. We won Clean Missouri. So I think sometimes people get discouraged and think, well, Missouri's just not going to do it. And I don't think that bears out with the evidence. I think Missouri does do it when we do it this way. Right. But like I said before, they did that in Utah, and Utah passed it through a ballot measure, and the legislature even messed with it, but still 90,000 people in Utah got access to Medicaid who didn't have it before. And I think that's still a win, even if it's not exactly what you were going for.
But I think that's our responsibility as well, to take our voice back. Because the legislature is not speaking the same values that the people of Missouri are. And that's evidenced by what happened at the ballot box in the midterm. And we have a responsibility to this community and to this state to be active, to get the vote out, to get like-minded folks to the ballot and get rid of those people in Jeff City who are not doing what we are asking them to do.
And I,
How are the signatures going? You know? Well, I don't know where we're at right now. I know there's a lot of people collecting signatures and a real big campaign has just begun. So.
And it hasn't even officially launched.
and I,
It's not even.
It's not, yeah, it's not even really launched yet.
We're still collecting. I mean,
They're still looking at it. It's not really launched yet, yeah.
what's the time limit? I mean, what are we looking at in terms of when it has to be in?
I believe it was December, I believe. Am I correct on that? Is Rebecca here?
Why don't you repeat what you said?
The actual launch has not started yet, even though we are getting signatures now. There's several of us that are, you know, I know Jobs for Justice is, Faith Voices is, and we've been working on it. And I believe we have until December, but the real launch is going to be over the Labor Day weekend when they're really going to make a launch of hitting it hard and heavy. So I think we'll have the signatures. One of the things that we've got to do, though, is they're going to lie about it. They talk about it's welfare people, it's people that won't work. They try to portray it as people who are takers. They try to say illegal immigrants are taking advantage of this, and we're having to pay for it. We Medicare people and we people that have our insurance are having to pay the bill for these illegal immigrants. It's on all over Facebook. So we have to speak out against the lies that they tell. And it's lies. It's blatant lies, and they know it is.
Right, and I want to offer some inoculation for when you hear that. People who are not in this country legally cannot qualify for Medicaid. They are not going to be, they're not going to be gaining anything from Medicaid expansion. So that, to whoever you're speaking to, that might be a comfort. The other thing, you also said that it would be a cost onto everyone else. We're already paying the cost for American citizens who have no other option but to wait until they are at like 100% emergency room time, and then they go. We are already doing that. So just want to offer that. So if you hear that. Right.
Way more money.
And not only that, and we're also not bringing back that $1.9 billion in federal money that we're paying out.
So Rebecca, would it be fair to say that the Medicaid expansion would be putting vets before illegals?
Yeah.
Yes.
Yeah.
That's a picture I see quite often. Yes. Vets before illegals seems to be a rallying cry from one
Yeah, and legally, I mean, that's what Medicaid expansion would be allowed to do.
I think that we also need to remember that it sounds cliche, but writing your state legislator, your representative, and your state senator, and letting them know you live in their district and you want common sense, you want them to use science and facts, and tell them we don't want to be in the bottom 14 states in this country and have our people dying and suffering like that poor woman was. I think we really need to remember to do that. Governor Parsons needs to he needs to hear from him. I know there's a lot of people in here that probably are sick of calling, but I do think it helps. And then, of course, sign the petition and find a candidate before you vote for him. I don't care how. I have a good friend that's running. He's not going to be for Medicaid expansion. I'm not going to vote for him. I don't care if he is a good friend. I'm not voting for him if he doesn't support some science and common sense and help our Missourians. So, my soapbox.
And I think science has kind of turned into a bad word in certain areas. So let's go with math. Because, you know, math doesn't seem as scary. It's not my favorite, but it's really important, I have found in my work.
I want to take just a minute and introduce two other candidates who are here with us tonight. Cindy, do you want to stand up for a minute? Cindy's running for the Missouri House from District 133. And she and I haven't talked about what she'll speak with people about when she knocks on their door, but I'm guessing that Medicaid expansion is right at the top of the list, as it would be for most Democratic candidates. And Dave Gregg, who's in the back here, Dave's running in District 130. And I'm in 136, yeah. And we have a question back here, I think. Oh, okay. It was mentioned by the panel tonight. Let's set aside the moral question for just a minute. But you know, here in Springfield, and I'm a member of a church, but we have so many faith institutions. And gosh, I have to believe that all of those faith institutions believe in the idea of helping those who need help. And I think we need to throw that up to these legislators, especially when they like to boast about, you know, their faith, and they do that online, obviously, or often is what I meant to say. So I think we need to hold their feet to the fire. So.
Rebecca, were you going to do another part?
Oh, sure. I kind of touched on the Medicaid purges. It's kind of called the Parson Purge now because he's refused to admit it. So basically, we're really trying to push for people to call and contact and draw attention to him on him ignoring 100,000 kids. Because like you said, like people say, like, you know, that their intentions are good, they want to do good in the world, but like even if the worst case scenario were true and these parents weren't doing their due diligence, do we really want to be the state that allows for kids to be dropped off of their health care because their parents made a mistake? That's not the case, but if it were, would we want that to stand? I think it's ridiculous. But if you guys want, I have like some flyers that have like things you can say if you call Governor Parson, has his number, email, all that stuff. So that's back on that back table if you're interested in reaching out to him.
But you're not going to have to pay double tax on your used car.
Yeah.
If you're one of those 3,000.
About 3,000 people versus 120,000 Missourians.
Rebecca, can you spend just a minute or two more and tell us a little bit more about Missouri Health Care for All? There are other people working around the state as you are here, and if I'm not mistaken, Missouri Health Care for All was created in large part through funding from
Missouri Foundation for Health.
Yes, thank you.
Yeah, so Missouri Healthcare for All, like I said, is a nonpartisan, nonprofit group. We work to make sure more people can access the care that they need, no matter where they live or how much money they make. There are a lot of disparities in our state, especially depending on where you live, and we really want to rectify that, especially with Medicaid expansion. We kind of work in a lot of ways. We do have our story collecting initiative that is ongoing, not just Medicaid stories, but anyone's health experience. We want to hear about it. We also do lobby days up at the Capitol to go and try and sway our legislators to, you know, pass consumer protections. Most of our work is with consumer protections, making sure folks on their employer plans and stuff have fair billing practices, things like that. We also do in-district meetings with people, so you can meet with your legislator. Jeff, you were able to be a part of that last December. And yeah, we also do story shares, and as we go forward with Medicaid expansion, with that pending, we will be a part of that.
It was a little awkward for me. Yes, I was in the meeting, and it was with the gentleman who defeated me and is now my state representative.
I didn't mean to bring that up. I'm
sorry.
No,
that's okay. But I recorded everything he said on my phone, and he said, as we started off, he said, "I don't know a thing about healthcare." So at least he was honest.
I appreciated his honesty, and it's really a relationship building thing. Like, you know, they may not agree with everything like Medicaid expansion, but if they'll vote for a surprise billing thing, then we can talk and offer education on what exactly some of these bills are. Because there are so many bills that are filed. And so sometimes when you tell them about it, they're like, this is the first time I'm hearing about it. So it's important work to do, even if it can be frustrating at times.
Do we have any more questions? This has been a great panel discussion tonight. We have a...
Yeah, I will not be at the Labor Day picnic because I will be out of the state. But yeah, we're going to be at the Me Too rally and also Ozarks Pride Fest. And sometimes we do tabling here at the library as well. So that's another thing we do to talk to people, hear their stories, and get them involved in the work we're doing.
I think
Farm
think
Fest.
I mean, I'm thinking of places where the folks that, obviously, we all need to be educated, but the folks that don't have access to the facts, it would be good maybe to do some tabling at those places. And Farm Fest is huge here in October out at the fairgrounds.
I'm writing it down.
Everybody's in white pickup trucks, so.
Yeah, we do have a big list of, I know that Rebecca and we have a big list of all the upcoming events.
Yeah.
I have a question here, and we are all giving good advice and good questions, but the person that we have to reach, in my eyes, is the person that is up in Jeff City instead of our representative, Jeff Mutzinger. And I think if the people that have gone to Jeff City would kindly stand up, that will tell you how many have gone to Jeff City. I myself have gone 3 or 4 times about any issue that pertains to our city and our taxes and our health care. I mean, see, this is, we order a big bus and only about 10, 15 people get on it, and this includes people from Joplin. So if you're really sincere, take a day off after it's been advertised that we're going in a bus, and get on that darn bus. I cleaned that up. So anyway, no, the thing is that there's strength and unity, and we have to go talk to I'll call it the gentleman that is up in Jeff City instead of our Jeff Munsinger.
Thank you. Do we?
You should have looked around. It was about 3/4 of the people.
There are some flyers. There are the activists. Like she said, you're preaching to the choir.
Yes.
We've got to go to the senior centers and different places where these people are in need of this Medicaid expansion.
And the churches.
And try to educate them
Yeah.
that it's for you.
Yeah.
It's not for most of us here.
And I will say when I was a navigator, when I was still doing that ACA work, a large population of people I saw were in that 60 to 64 range who were retired, weren't healthy enough to work, but didn't qualify for Medicare and could not get Medicaid. And there was a lot of people that I had to say, I'm sorry. And they would say, stupid Obama. And I'd say, no, that's not what it is. But that's the whole thing, is that people blame the ACA and not where the blame is.
Right. Yeah.
Some of the people are being affected worse, and I brought this up at another meeting, are people in the rural areas. We in Springfield and those in Columbia and Kansas City and St. Louis have a little better deal, access. But these people out in the middle of nowhere, places where hospitals are endangered or closing, like around Osceola and not Mount Vernon, but several other cities, they're the ones that are going to be are affected by this even worse than us. We see stuff on TV all about this. So these people probably would be good good possibilities for signing the petitions. And so that's maybe where we should go too.
And I will say a lot of the narrative around that is that race class narrative, and that rural people or people down here don't want to spend money, so people who are in urban areas can have access to health care. And I'll say that when I was a navigator, I had counterparts in St. Louis who did the same thing I did, and they had like 3 or 4 programs they could sign people who were in the Medicaid gap up for to get them some help. We didn't have that here. And so while they always have that idea in their head is if we do Medicaid expansion, it's going to help those people in those urban areas, and that's not true. Like, it's true, but it's also going to help you and your area, and probably more, because they do have more access to other alternative
solutions to their issue than you do here, even in Springfield. It doesn't have to be rural like Osceola or Mount Vernon. Springfield, we don't have those here like they do in St. Louis or Kansas City.
I just had a comment. I have a comment. It came up, go to the senior centers. I just wanted to point out that if you're 65 and your income is below 100% of the federal poverty level, you get Medicaid. So yes, go to the senior centers because there's people younger than 65. But what I see in my business, I work with Medicare insurance products, and I think it's wonderful that once you get to the ripe age of 65 and your income is low, or you just can't work anymore, you're just burnt out, or your body is wasted, there are some helps. Also, you get help with your prescription drug cost if your income is up to 130-something%. I don't know what the numbers are, but there's extra subsidies for your prescription drugs if you're above 100% of federal poverty, but you don't have Medicaid. Again, I just want to, I'm just reinforcing what's been said. There's a lot of people who would love to retire at age 50, 55, 60. They're sick. My story, my cousin died at age 65. He was self-employed. I don't get into his affairs of his widow, but I'm sure his health care throughout his mature years was very poor. He just did not survive because he did not have access to good health care like I have always had a good employer plan. That's my point. Once you're 65, if your income is down there, you do get Medicaid, even in Missouri.
I want to ask a question about something that I'm really not familiar with, but I say we, the state now employs a third party, doesn't it, to administer Medicaid? You're smiling. Can you speak to that? I don't know if that's good or bad.
Welcome to managed care. Basically, this is an entity that is paid not to try and take care of people in a better way, but to take care of people in a cheaper way. I can't name them exactly, but basically, their main goal is to cut costs for folks who are on Medicaid. And that's really appealing to some folks in Jefferson City. They really want to cut costs instead of accept the, $1.5 billion that we've already paid. But yeah, so basically that's what that is about. And it really is not effective. And there have been a lot of issues with it. And people have had to change their doctors. That's kind of what it looks like. They have to change their doctors. They get less of a pool of providers to choose from. And that can really affect a lot of people, especially people who are, have transportation issues and they're not able to just change and go all the way across town. If you have limited mobility, you need to go where it's closest. And if that changes, then there's nothing you can do sometimes. But yeah.
Another thing, I think the governor has said he wants to convene a task force now to look at Medicaid.
Which one? There's two. One, there's a task force put together to be looking at fraud. It's kind of difficult for there to be a lot of fraud when it comes to Medicaid because you have to go through so many steps to qualify, and even then you may just get dropped under the current administration. So there's a task force looking at fraud. There's also one looking at expanding Medicaid, and we shared this on our Facebook to kind of give people a heads up that this is not the Medicaid expansion we're talking about today. This is through using a waiver. It's called the 1332 waiver, and it would basically allow for the state to control more of what happens with all this Medicaid expansion money. We can kind of taper it, and we could make it make people have to meet work requirements, so they'd have to submit income. They'd also have to submit data from their employers about how many hours they're working. We've fought against busy work requirements this last session and will continue to for quite a long time. And so that's something that we've seen, and it's just a popular phrase. I'd like to expand Medicaid, but I don't really want to expand Medicaid. So those are the two task forces going on. So sorry if it's confusing. He's got a plan for Medicaid, which is not the best for Missourians.
while we're there, Rebecca, would you talk about why work requirements are a bad idea?
I would love to. All right. So, why are work requirements a bad idea?
And they've been declared unconstitutional, I think, in some states.
In 2 states they have. Yeah, they passed in Kentucky and Arkansas, and they've been deemed unconstitutional by a federal judge. So, Skylar, actually, if you want, I still have that picture from last time on the flash drive. So basically what busy work requirements would do is that would say that, okay, you are qualified for Medicaid right now, but you have to work like a certain number of hours. Let's say you have to work 20 hours a week, every week, to maintain your Medicaid benefits. This is not helpful for people who work in the food industry and their shifts change all the time. So it's really not a good idea because already our basically, we have such low income, like thresholds, exactly, thank you, that whenever you do meet the work requirements, you actually will make way too much anyway. So you'll meet one requirement for Medicaid, but you will fail the other. Yeah.
Then you'll be kicked off because you surpassed the ridiculously low threshold.
Exactly. So the only way working for those busy work requirements that were proposed, you would have to make like $692 a month at minimum wage. Unless you have, let's see, set a family size of 7 or 8, you're kicked off Medicaid, even though you met the work requirements. So that's why work requirements are a terrible idea, and the only purpose is to kick more people off Medicaid.
We have a question, yeah.
I know that hospitals have lobbyists, but they're not very vocal about passing Medicaid. I would think it would benefit them greatly.
It does. It does. It would benefit them very much, but they have, I've noticed that hospitals tend to have kind of a more, try to stay more neutral on this sort of thing. I would really love to be curious about their pocketbooks and see the exact financial benefit that they would reap with this. But the general mood I've been getting is that they approve and would want it.
Do we have any other questions or comments? My gosh.
I just want to remind everybody, we're talking about 500,000 people in Missouri with no health care. And I forget what is it 12 million? I don't know what our population is.
It's
That's a lot of people.
200,000 or something like that.
Medicaid expansion would put half of those people with some health care. I mean, it's not all of them, but it's 250,000 people. It's the least of us, is what I always think. This is the least of us.
Well, panelists, Kristen, Lynn, Rebecca, Dr. Adams, thank you so much. This has been really enlightening. Thank you. Any final comments? Oh.
10% of our population.
Yes, I believe we both do. Do you have some?
I didn't bring it in, but I do.
Yeah.
Yeah, please. Our next forum is Wes.
Our next one is on teacher retirement. It's on Wednesday, September the 25th. And Steve Yoakum, who's the executive director from the PSRS, will be here, as well as Jim Kreider, who's the executive director for the Missouri Retired Teachers Association.
Another reason to come, you will learn about the threats that our teachers' retirement system are always under. The legislature would love to get its hands on the teachers' retirement system, and frankly, they have no business doing so, but they're trying and they continue it. And so it'd be a great evening to learn more about that. So, yes, here. Yes. Same time, 6:30? Okay.
Last Wednesday of the month.
Thank you all so much. And anybody can circulate petitions. So don't hesitate with training. Yeah, it doesn't take much. It doesn't take much. You just have to make sure you fill out everything correctly.